I wanted to be a doctor, and I think specifically a surgeon, since I was a little kid. I'm sure I was influenced by my father. My father was the old-style general surgeon who was kind of like a family practitioner and surgeon. He really talked to patients, listened to them, understood them. He derived tremendous satisfaction from caring for people, and he was a great example to live by. Since coming to Akron General, the Cleveland Clinic cardiac surgery program, we've really bolstered the capabilities here. So we're doing not just coronary bypass, which is sort of the bread and butter of heart surgery, but riskier cases that involve left ventricular support, much more in the way of valvular work, so mitral valve repairs, aortic valve replacements, some minimally invasive approaches, aneurysm work, arrhythmia work, and then most recently, we've started our transcatheter aortic valve replacement program, which is just so important for this institution. We've structured things so that virtually every patient who's being considered for some form of cardiac intervention is assessed by, reviewed by a whole team of people, so that we have multiple perspectives and come up with the best plan. We want people to get the best outcome, have the safest experience, and have the best opportunity to get back to normal life.